So we will now enter into our expert panel, and I really appreciate our panelists for being here. We're going to first let everyone introduce themselves, say a couple of minutes about who they are, what they do, and then we're going to have time for our audience for questions and answers. And this is all about just a career in medicine and scholarship and how people combine them both. So our first panelist for our introductions today is Dr. Molly Jackson. Thank you so much for being here.
Thank you for having me. Can you all hear me okay? Yeah?
Yep.
Great. Glad to see everyone's smiling faces. My name is Molly Jackson. I use she, her pronouns. I am an internal medicine doc, a generalist here at the University of Washington Medical Center, Montlake campus in Seattle. And I've worked primarily on the medicine consult team and a little bit in the hospital medicine group and general internal medicine wards. And I'm switching to primary care actually this fall. So I have an upcoming transition in my clinical work. I have been a part of the college's program, which is our clinical skills, professionalism, and mentoring program in the School of Medicine for medical students for 12 to 13 years or so. And I'm the assistant dean for that team. So I work really closely with our college's faculty heads across the region and our faculty who are teaching bedside physical exam and history taking and communication and professionalism. I have a special interest in bedside physical exam and teaching clinical skills with patients, and have done a lot of different kinds of scholarly work. I'm sort of a generalist by clinical training and a generalist in scholarship. I've done a mix of different things from writing books to being an editor to helping students with scholarship to doing qualitative research and some quantitative research. So I've had a bit of a potpourri of medical education, primarily scholarship. And I'm glad to be here. Thank you for inviting me.
Excellent. Thank you. Dr. Marianne Overland is next on our panel.
Hi, everybody. Thanks for having me. And how delighted am I to find out that the wonderful Dr. Jackson will be coming to the world of primary care. You're quite welcome. So hi, I am a primary care internist at the VA in Seattle and also the Associate Program Director for Primary Care for the Internal Medicine Residency at the University of Washington. I went to medical school in upstate New York at University of Rochester, did my primary care internal medicine residency at the University of Washington, and then clinician teacher fellowship at the VA. And I started my career as a full-time clinician educator. At the time, that was 90% clinical and 10% protected time. And I would say my lesson from my very first year of career was that ask and you might receive. I got this 10% of time protected to do scholarship from the get-go because I asked for it. And a lot of my colleagues were like, wait, what? How did you get that? And I was like, well, I asked. And Dr. Whip said, okay. So you don't always get what you want, but you definitely won't get it if you don't ask for it. A year into my career, the APD role opened up, and it was always my like pie in the sky dream to have this job. And I thought, I'm certainly not ready for this, but I'm going to go for it anyway. And lo and behold, I got the job. And theoretically, that's a 50-50 split, primary care and sort of clinical or academic or administrative educational. But I would say early on, it was sort of 75.
I mean, second year medical student, I thought very impressive work.
And I would say if you're taking on new roles, always think about right-sizing the other roles that you already have. I participated in the Teaching Scholars Program at UW in 2014, which was a wonderful interprofessional program for teaching scholars to learn about educational research. And it was a wonderful program. I wish I'd waited a couple of years because I was still very early in my career and I didn't really know what my questions were yet. And I also had really young kids at home. Couldn't really dedicate as much time and attention to it as I wish I had. So I think from that, I learned like you can do everything, but you don't have to do everything at the same time. Like it's okay to sort of pace yourself a little bit. but now I'm sort of in the 50-50 clinical and non-clinical mix, and I love it. And I didn't initially know that I would love scholarship, but the like competitor in me would go to meetings and see other programs like broadcasting what they were doing. And I think we're already doing that, but we're doing it better. And like, why aren't people paying attention to that? And I'd realize, well, because you're not telling anyone what you're doing. And so really the desire to really disseminate the UW way of primary care was a big impetus for me. So started with sort of regional, then national meetings and things like abstracts and workshops, but have extended to become part of sort of inter-institutional working groups looking at primary care training, both from like the med student to residency transition, all the way to primary care graduate outcomes and careers. And have gotten a chance to work with some really fabulous people, basically just by asking. Again, you just like walk up to people at meetings who you admire and say like, you seem amazing. Can I talk to you about yourself? And people love talking about themselves, and then often will be more than happy to bring you along, which I think brings me to like sort of mentorship and sponsorship. I think it's really important to have good mentors and sponsors early on. And I sort of think of the difference as the mentor is the coach and the sponsor is the snowplow. Always good to have some of each in your corner. Working with collaborators is super important, both to hold you accountable, but also to keep your ideas fresh and broad. And then thinking about balance is hard, especially as a primary care doctor. You're never off, even if it's not your clinic day. Your patients don't really know or care what day that is. And so I think having a good interprofessional clinical team who can help protect you a little bit is important. So working with your nurses and other professionals within your clinic to let them know kind of what you're doing and when to interrupt for emergencies and when you're going to be back. For example, I will tell them at 2 p.m. today, I will be back for you doing clinical work. Anything that can be held up until then, please do. If it's an emergency, obviously interrupt me. But if it's not an emergency, I promise I'll be there at this time and then reliably be there so that they know that they can count on you. Thanks for inviting me. I'm happy to answer any questions.
Thanks, Marianne. Next for introductions is Dr. Annalise Shire.
Great. Well, thank you so much, Sandra, and thanks. It's really nice to see all of you and great to meet you. So I'm Annalise Shire. I am a hospitalist at Harborview, and I've actually been in that role for almost 19 years. So it's been a while. And I am the Associate Chief Medical Officer of UW Medicine. And in that capacity, I really work together with leaders across UW Medicine in the areas of equality and safety. So I would say on the scholarship side of my career, I have always been focused on quality and safety. I actually did quality and safety before I started medical school. So I always had that interest in both working with individual patients and having the privilege of caring for them individually, but also thinking about how what we learn from our patients is what inspires us to make things better. And so working in the areas of quality and safety have really given me a chance to learn from our multidisciplinary teams about the system and how the system in which we practice does have an impact on the patients we care for. And so, but I've always found the patient care piece, I do about 25 to 30% now, has always inspired the areas that I've focused on in the quality and safety world. I do have a largely administrative job at this point, and so some of my quality safety work is driven out of my patient care, and then some of it is driven out of the needs of the health system. The particular areas that I've focused on are around venous thromboembolism prevention and anticoagulation safety. And then I've also worked a lot on resident and frontline engagement in quality and safety and academic promotion in quality and safety. I do think that's something that is changing, and I think that's a great opportunity for those of you who are interested in really growing those areas in your life and your career that you're inspired by and excited about, and how you can turn that into an academic career. So I would say on the scholarship front, I would say when I first started, I really started in my role because I wanted to work at Harborview, and that was really what drove my decision making. But scholarship is a part of an academic career, and I didn't realize how much I would actually really enjoy it. But over the years, it's really become an incredibly meaningful and valuable part of what I do. I think that I approach every new initiative as an opportunity for scholarship. And I think about scholarship broadly. So, I mean, scholarship is thinking about and learning from what you do. But then it's also about sharing. Marianne highlighted that, like it's an opportunity to share with your colleagues, both within your discipline and across disciplines. But then it's also an opportunity to share regionally, nationally, and to learn from each other. So I think, so every initiative I think about from the beginning, before I even start, how can I approach this so that eventually this will turn into scholarship? And with whom can I partner? And so we've heard a little bit from Molly and Marianne around mentorship. You know, a huge part of mentorship is peer mentorship. It's your colleagues. It's who you get to partner with, be it the nurse you're working with for a particular patient, be it a national committee where you're working with, for example, hospitals around the country. These are your partners and your colleagues, and they're also your mentors and you're theirs. And so to me, that's been a really fun part about scholarship is the opportunity to learn from others and to learn together and to improve together. And so I think your colleagues, your mentors, and being a great mentee are all really important things to building your career. So thanks for the opportunity to be here, and look forward to our ongoing discussion.
Excellent. Thanks so much. Our next panelist today is Dr. Linnea Schuttner. Hi.
Hi, can you hear me? Okay. So thanks for having me. This is a really, pretty exciting panel. Colleagues, and I work with Marianne over at the VA Primary Care Clinic. I am an instructor at the University of Washington, and I'm a clinician investigator with the VA through Health Services Research. And my path to scholarship has been a little bit circuitous. I started in medical school as a Fogarty clinical scholar, and spent about a year working on a randomized trial to improve health systems in rural Zambia, and then came back to medical school, went to UCLA for my internal medicine pediatric residency, dual residency, which is not at all what I practice now at the VA, and really focused on both global health and UI actually while I was a resident, and never thought I would become a physician scientist. But when I finished, I spent a year doing urgent care, and then took some time off and hiked the PCT and decided that I really wanted to do kind of operational policy work. Unfortunately, the same year I decided that, they got rid of the Robert Wood Johnson Fellowship, which is what I had been planning to do. I didn't know what to do, so I applied to the Health Services Research Fellowship at the UW, which then also disappeared, and I ended up transferring my application to the VA side of it, which I never thought about before and hadn't been involved with previously. And the mentorship team for the UW side fellowship was actually the same as the VA. Dr. Karen Nelson, who's my primary mentor at the VA. And she talked about how she was working with patient-centered medical homes and systems of care, and was focused kind of on care delivery quality. And that was right up my alley thematically, but I never thought about working with veterans. So I switched my application and did an HSR&D fellowship at the VA in Seattle, and ended up really loving doing research. And I never thought that that would be a formal pathway for me, because I'd been really interested in kind of this operational quality hybrid career. But it turns out with being a physician scientist, I kind of get to have the best of both worlds. So when I finished my fellowship, I jumped in full head to it and applied for a K-12, which is a full research support grant, was awarded that. And I focus now on learning health systems and quality improvement work, but within the context of really rigorous health systems methodology. So I was able to mirror both my interests and kind of focus in on that care delivery piece, but really from a research background. At the VA, I do 75% research, working with my mentorship team, and I'm putting in for my next grant in about 2 weeks here. And I also do 25% primary care, which I split between precepting residents and doing my own patient panel. So it's kind of been a long journey. I no longer do any pediatrics, which is sad, but that's And yeah, and it's been a very, I suppose, interesting hybrid of all of the ways that you can be a physician scientist. It doesn't necessarily mean that you're just writing grants and putting out papers, but it really means you can kind of adapt it, work with operational partners, incorporate aspects that you enjoy, and get to be creative at the same time. So that's how I've taken on scholarship, and yeah.
Excellent. Thanks so much. I'll echo exactly what Dr. Holland just wrote. Dr. Shuttner is highlighting embracing flexibility. Sounds like it. What a journey. Thank you so much. Our next panelist is Dr. David Watkins.
Hello, and thanks again for having me too. So I am an assistant professor in the Department of Medicine, GIM, and jointly in the Department of Global Health. And similarly, I'm a bit of an odd duck. I do health systems and policy related research, both to focus on low and middle income countries. And so most of what I do is outside the US. In fact, almost all of what I do is outside the US in terms of my work. And I'm in the physician scientist pathway. So about 2/3 to 3/4 of my time, depending on the week you catch me in, is research. And when I'm doing clinical care, I work at Harborview as a hospitalist, and that's great, along with Dr. Schleier. Harborview is cool, not as cool as the VA, but cool enough. And I started out with a pretty strong sense that I wanted to do this sort of work, but without a lot of clear on-ramps within GIM and within the Department of Medicine, because it was just not a typical career like health services, health policy stuff domestically a little bit, but not so much internationally. And there weren't a lot of obvious funding opportunities. And so I pushed forward with essentially after residency in internal medicine at UW, creating my own research fellowship. I did a Master of Public Health and worked part-time as a hospitalist. And I got some great advice from Jim Legirfo, who many of you may know, who said, don't worry about going off the beaten path that serves your interest. And it actually was a really great decision for me to do that and kind of put together my own training program. And then after that, in 2015, I transitioned into the physician scientist role as an instructor and then assistant professor. I think that for me, a couple of the really important things that have determined success in scholarship for me are, as I just suggested, being willing to take risks. And early in your career, there's obviously a certain type of typical trajectory that people recommend to you, and I think that's important to honor that and explore that. But I think you should always stay true to yourself and what your interests are, and explore ways of moving beyond the sort of norms if that's not you. In general interest, we tend to be very multivalent and with a lot of interest, and that doesn't always fit into the kind of academic PhD pigeonholed sort of like siloed model of research. And so it's okay to explore different things and do things a little bit atypically if you provide value and add value to the scientific community. And so whether it's putting together your own fellowship or kind of having an unusual network of mentors or whatever, I think that's really important. And I also agree that mentorship is really key, and people who have your back, making sure you have opportunities to go to conferences, to present at conferences, to lead papers and other projects that can elevate your profile early on and make you more competitive for funding is super critical. I think one of the things I worry about with sort of successive cohorts of residents is the decreased excitement in scholarship that I seem to sense is a lot of people are kind of scared, especially of research and of the physician scientist pathway. A lot of people say, well, I like the idea of being involved in research, but I kind of want to be mostly a clinician and I'm scared of writing grants. And I think, it's okay if you make that decision, but I think a lot of people actually don't have the right sorts of experiences as trainees with research. And I think if you're finding yourself not inspired by a particular project, go find another group to work with for a year or 6 months. Go do something completely different. I, have a biochemistry degree. I don't use it at all anymore. I do economics research and policy research mostly. I found my way via epidemiology, which I also didn't find that inspiring personally. But if I'd stopped there and said, this is not that great and I don't find it that useful, I might have never gotten involved in what I'm doing. So be willing to go and meet up with other groups, get involved in a small level in projects that you think might be interesting, explore, be willing to say, this isn't for me, I'm going to move on to something else. And really, the second piece of that is when you're early in your career, making sure that you identify people who are at various stages of their career, who are senior enough to really support you, who are not maybe just totally invested in the system at your institution, who can kind of provide an outside perspective to provide advice, and be sure that you're again, not being just led into what other people are thinking you need to do. So I think those sorts of elements are really successful. for me, but I think making sure that you have opportunities to practice writing grants, to practice writing papers, to get that exposure early on and explore different areas so that you don't, sort of turn yourself into something you might be successful in. Because I think that a lot of people, really probably have scholarly oriented mindsets, but don't feel like they have enough skills or the right kind of experiences during residency and fellowship. So seek those out. If they're not working, try something else. Give yourself the benefit of the doubt, because there's certainly a lot of needs out there for medical scholarship and a lot of great minds here. So, and I'm happy to answer questions for anybody who's more interested in what I do in particular and how I got to where I am.
Excellent. Thanks so much. Our last panelist is Dr. Chen Wu.
Hey everyone, I hope you can hear me. So I'm Chen Wu. I'm a hospitalist over at the VA. A little bit about me, I think, to echo everyone else's comments about sort of a Brownian motion way of getting to where they are. It's also been quite random for me. So I started out in at Dave Watkins' alma mater at Duke for med school, and I think I was looking for some opportunities there in terms of getting, like good CV stuff. So the IHI Open School was looking for a president. So I jumped on that. So random encounter number one, but really liked the patient safety aspect of things and the healthcare improvement part of things. So that was my first dabble in the quality improvement. And that's kind of been my trajectory since then. Came here for residency and more or less a standard residency experience. But one thing that was awesome was getting to participate in this health systems immersion block that at the time was led by Dr. Jen Best and has sort of evolved into a more formal pathway under Anders Chen. So that was incredible. That was like 4 weeks of just diving into systems and getting to understand sort of patient safety, but beyond that, sort of how the whole back end of Harborview and the U worked. So processes, even a little bit of finances. We did root cause analysis on quote unquote missing instruments in the OR. And that was just sort of the tip of the iceberg, and being able to see going all the way down to sort of these misunderstandings that spiraled out of control, and getting to kind of help formulate the improvement plan for that was really awesome. And learning a bit about behavioral economics, which was something that I was really interested in med school, and reapplying that to help people sort of get those misunderstandings under control. So that was really fun. So after that, that sort of set me down a path to apply for the then new chief resident for quality and safety position at the VA. So I was the second one behind Nick Mayo, and that's a name that you guys will probably be familiar with. So followed in his footsteps, and I think generally there's somewhat of a Nick has blazed a trail that I'm happy to walk mostly down. But so did that for a year, and Vince Rakel will be our next CRQS here at the VA. And that was fun, and that was exposure to the VA side of things and getting more into patient safety events, really understanding what Swiss cheese is like, and getting to also lead, so flexing some of that leadership ability with the House Staff Quality and Safety Committee, getting exposure and being mentored by folks like Annalise and Dr. Joyner through the HQSC. That was really, really fun. And also at this point, starting to get a little bit more familiar with big data. So the VA has a huge set of performance metrics, and getting to kind of dissect that and see what it's good for and the flaws in that was really also eye-opening. So understanding that I like patient safety, sort of the accident investigation and how to learn from that, process improvement and QI, and also sort of big data. Those have been the sort of cornerstones of what I do now, which is hospitalist when I'm clinical, and then a huge portion of it is non-clinical. So that is running the Office of Transformation here at the VA, which does sort of lean methodology and trying to fix processes that may not work as well. And being kind of a data whisperer for those performance metrics, and being like, no, don't go chasing after this, do chase after this, because this is legit problem. This is just low sample size, that kind of thing, to help guide some of the operational decisions at the VA. And then another huge part is just teaching residents on quality, safety, and patient safety topics, and also starting to do a little bit more with the data side. So me and Anders tested a small data curriculum this past year as part of his pathway. So yeah, so I think that's kind of it. So like managing QI projects, coaching folks, and kind of doing that teaching for staff here. Doing some of the data work that is somewhat of a niche, and that is sort of, I guess, a special area that I've carved out for myself, and then educating house staff on QI. So being sort of a mentor, at least to the CRQS. And yeah, I think that's generally it. It's real fun. I think just philosophically, it's real fun to do QI, and to I have a real passion for seeing how it intersects things like the stuff that's out there in industry and commerce and innovation. So SpaceX is kind of like the poster child for doing these rapid iterative PDSAs. So I give a plug out for, watch their YouTube videos, because it'll show you how to do QI, and then how to make that interface with the clinical side of things, and how you can take a standard H&P and basically use that to do QI. So those are all kind of fun things. That's the part that really energizes me. And the other part, I think, in terms of mentorship and peer mentorship, and just so there's the authenticity side, following your passion, and then surrounding yourself with people who energize you. So I'm here in the hospitalist team room. I gave up my offices because it's just more fun to work with this group of people back here that's walking around. And also keep my ear close to the ground in terms of what's going on at the hospital. So yeah, that's me in a nutshell. And thanks for the invite to come here, and looking forward to the Q&A.
Great. Thank you so much. Thanks everyone for your introductions. I've already got some questions coming through here on the chat. So from Dr. Holland, do any of our panelists look back and think they missed a scholarship opportunity they wish they had taken? And if so, what might have you done to better recognize an opportunity as it comes along?
I can respond a little bit. I guess I think I'm probably constantly missing opportunities because I feel like I have questions every day, and I meet people I admire and hear about ideas every day that I think, oh, that would be so cool, or and I just don't think there's enough time in the day to do everything. And so it's sort of one of the things Dr. Whip says is, Marianne, you can have it all, you just can't have it all at the same time, right? So it's just about thinking about what's the next year, what's the next 3 years, what's the next project, and sort of keeping a running list of other ideas. But we're constantly probably having to like block out the noise of good ideas, or at least like defer them, because you can't do a good job at everything at the same time. So I think early on, I kind of said yes to everything that came along, because I didn't know what I wanted to do. And so I was writing review papers and getting involved in other, and like wrote a paper about dyspepsia, which is like, I'm sure no one has ever read, and but just trying to figure out, like, is this my jam or not? But I think it's okay to be sort of like a little bit scattered or a little bit broad at first and then narrow. But yeah, we're constantly, and then I think anyone who's clinically active or administratively active is constantly thinking of questions and problems that they would love to solve if only time were endless and resources were endless. But that's one of the cool things about our job.
Great,
Marianne,
thanks.
I think that's a great perspective. I think one of the things looking back as I think about that question is, part of a career, we talked a little bit or have referenced mentorship, either peer mentorship or, professional mentorship. But there is also making sure you take the time to pause for yourself, almost to be a mentor for yourself, and say, what is it that's important to me? Because I agree with Marianne, right? Like, you're so lucky to, in residency, right? You meet all these great people, your resident colleagues, the students, your attendings, the nurses, like there's so many ideas, and you could do any one of them, and you could make any one of them into scholarship. But you know, so in the beginning, you're doing a little bit of testing, rote testing, but over time, you start to say, what matters to me? What are the things that that I can be involved in, and what are the things I want to lead, right? And those, I think, over time, help you fine tune those areas where you do your scholarship. So in the beginning, like Marian said, I was kind of interested in everything. And over time, I was like, well, I love VT prophylaxis. So if there's an opportunity around that, I'm going to take that and try and get as involved as I can. And the other things, I'm happy to support it or work together with people, but I'm not going to spend as much time on it. So that sort of self-assessment, you know, where am I? What is my passion? And how can I grow that? And I do think in the beginning, though, you know, part of learning is saying yes to a lot of things. And then over time, as you build your career, you say, this is me.
Excellent. I love that. I have, I don't know if it's a student or a resident with their hand up. Kanisha? I'm sorry,
Yeah,
I'm botching
no
your name.
worries. No worries. My name is Ksenia. I'm
Sorry.
a rising MS4. Yeah, I had a question regarding, and I know that this will be kind of very big question and kind of piggybacking already what was mentioned, but I think I want to maybe hear more concrete strategies or solutions that were employed to create a space, to negotiate a space, in maybe a job contract or whatever, for scholarship. And it could just be one example that folks might bring up. I would love to hear more about that.
That's a great question.
So I think just relating my personal experience here, some of it is that the VA may have a bit more latitude or historically had, which is great, right? So and there's a commitment here to train folks. So there are, you know, there's the chief resident in quality and safety, there's the fellowship in roughly the same thing. So they have formal programs to build a skill set that can then be leveraged. So if you think about sort of, again, I was the second year, and the first year of that was Nick Mayo, and he's currently in Annalisa's old slot as the associate medical director for quality and safety at Harborview. And that's a pretty substantial rise fairly quickly, but I think what it was, some of it is luck, some of it is recognizing opportunity, is that this is a highly sought after skill set to be able to help institutions improve their quality, the quality of the care that they deliver. And it's a somewhat of a skill set that until recently hasn't really been taught broadly in training. So finding those niches, especially if they align with your interests, is that's really serendipitously awesome. And I think that's similarly for me, kind of mentioning the data stuff. You know, it is a skill set that is very limited, at least on the operational side. We have a lot of folks in the research side who could absolutely do this, but it's the marriage of this particular aspect of VA big data and operations and the stuff that the hospital is beholden to, and this particular skill set, and just kind of finding the intersection of that gets, you know, that is 50% of my time right there that they've bought out. Yeah, I just keep your eyes peeled for these kinds of opportunities, especially like maybe the area that you're interested in, but then the novel take on that and how it is might be attractive to the organization that you want to work in.
This is Molly. I think it's a great question too. I've never had actually particular carved out time just for scholarship. And I've figured out with my clinical teams how to kind of weave it in to the work that we're doing. So one example was we created a handbook in the perioperative medicine team. And we just used our lunch conferences for an entire year to teach each other. And that created our handbook. It kind of created all the topics that we wanted to build upon, and different folks helped kind of write up different topics. So I think you can weave it in to actually your regular work, and also think a little bit about, a lot of this is actually on us prioritizing our own time and choosing one or two topics rather than getting ourselves into 15 different topics. And Matt's original question around, gosh, what was an opportunity you missed? I think I actually had the opposite. I think I got involved in too many projects, and then I was not really getting any one of them to the finish line. And I think that a little bit about this is like, what kind of creature am I? What are my issues? And knowing yourself, it might be actually not taking opportunities and double down on a couple of them rather than the opposite. So this might be a little bit different for everybody.
I agree. And I think also, you have, you're not coming from a position of much strength if you go to a negotiating table and say, I would like you to pay me to do this thing that I can't demonstrate that I'm already good at. So it's doing the work up front to some extent. And in some way you have to kind of hustle early to say, look how productive I can be with just a little piece of the pie. I can write all these papers, I can write these grants, I can do this research, I can do this quality work. And then you demonstrate, like, if I had more time, I could do even more of all this wonderful stuff. And that's how you go to a negotiating table from a position of strength, rather than like, I just know that if I only had some time, I could do something with it. No one's going to buy down your time for potential. They're going to buy down your time if you actually like have the receipts to show for what you can do ahead of time.
Excellent. Love it. I have another question from Brittany Ward, one of our residents.
I'm a second-year internal medicine resident over in Spokane, and I think through residency, right now I feel like one of the biggest pieces I'm struggling with incorporating research and academics into my training is that, similar to what you guys have already elicited, that I tend to get spread fairly thin with multiple different projects going on. And I was hoping, not necessarily per the projects, but if you guys could give some advice in terms of balancing multiple resident mentor relationships at one time, and balancing your kind of commitment to either one mentor focusing on one project versus spreading yourself amongst multiple mentors doing multiple projects, and how you guys have navigated that and how that's helped you then ultimately become a mentor of residents and medical students.
I have some thoughts on that if nobody else does. Oh, sorry, Lenny, I jumped ahead of you. I think I'll start by saying a couple of things. First, when I was a resident, I worked sequentially in 3 different groups. During my first year, I kind of worked with a cardiologist on like heart failure and socioeconomic status stuff in the US. I was like, I don't know, whatever. And then I was doing like a clinical epi sort of project on antenatal screening for structural heart disease in South Africa when I was doing global health pathway. I was like, this is not that interesting. And I finally got involved with a group doing global health policy stuff, and I started doing modeling and these things. And it was really exciting, but that was really my 3rd year of residency. I had to say no to a couple of the people and say, sorry, this isn't my jam. And I'm lucky I got some work out of it during residency, at the end of residency, out of the project, and was able to publish a couple of papers, but it took a lot of time and effort to get that done. I think in hindsight, what I probably, I don't think the relationships went badly. I think that probably what the advice I give in hindsight is that for residents to try to like focus on what your next steps are after residency or what you think they need to be, and find a mentor relationship you can put the quality into it. So like, for instance, I have a resident I'm mentoring right now who is in the global health pathway, who wanted to be a cardiologist. I said, whatever you want to do, I have a clear plan for you. You need to get at least one paper, you need to get at least one abstract, go to an AHA conference, all this sort of stuff. Like, let's work out a timeline for getting all this stuff together by the middle of your 3rd year, because that's the most important thing, regardless of all this other sort of stuff. Like, that's your next step. And so as a general internist, maybe you don't have that level of competition and insanity. And so, it's a little bit of a different sort of more feel your way through it kind of vibe. But I think it really depends on what you want to do after residency to sort of set yourself up for success, making choices consciously to use your time well, because you don't have a lot of it. I'm always telling my residents that I mentor, don't promise, don't overpromise and underdeliver, because that's a big problem. And so focus on like one thing, get one project, one paper out. You can read about some other stuff, but do one thing at a time and do it well, because that's more important during residency than doing a bunch of projects and not seeing them through to completion.
Yeah, I think
I'll
that's
follow up on that.
great advice. I mean, I think
Go
you
ahead.
have multiple mentors at every phase in your career for different reasons. Some are kind of life mentors and some become career mentors or paper writing mentors. But I think I've heard from a number of our panelists, getting to the finish line is really important. So as you think about getting involved in a project, it's, you know, it's important that you're going to have the bandwidth to say, if I agree to this and work with this mentor, I'm going to write that abstract, right? Those are the kind of things that really help strengthen and build those mentorship relationships. But mentors, especially in academic medicine, are very used to having people's career grow and change, and you have different mentors along the way.
Thanks. I think Dr. Shetner wanted to say something too.
Okay, being assertive on Zoom is not my forte. I was just going to speak to a couple of the points that have come up that, you know, as a fellow, I think when I was doing my fellowship, I probably met with I would guess over 100 people. I was first trying to find a really clear defined path, because, you know, you're feeling like this is establishing your plan for going forward. And you have to be very deliberate about trying to find opportunities. If you want to get involved with multiple things and you don't quite know where your interests are, I found it really helpful to try to seek out projects and mentorships that were kind of dual applications. Like if I was interested in, you know, a topic that somebody had, but it didn't quite fit into my pathway, I would think about, well, maybe there's a subset of their data or a subset of their work that overlaps with it, so that at the end I could have at least a descriptive, like, cohesive quality. Like, this all fits under primary care delivery models, even though I'm doing X, Y, and Z, that's very different. So I tried to think about, one, finding opportunities that overlap, that at least, you know, if I wanted to write a paper on dyspepsia, that I could like bundle that into my overall pathway, so my CV and my like pathway looks pretty cohesive. And then two, I think trying to find mentors that were really specifically teaching me different skills. So, you know, if I was going to learn QI, specifically like a method for QI, I would use that as a mentorship project relationship. And another mentor I would learn health economics from. And so that was like trying to mix and match, so I wasn't getting overlap in terms of the teaching that I was developing and the relationships that I was developing. Obviously I have lots of different interests, and it was really trying to figure out like, how can I come out of this with a package of skills and like figuring out who I am along the process, that I can use those relationships to figure that out and those projects to figure it out. And then I think the third thing was trying to be really clear when I didn't want to be involved in something, so that I wouldn't accidentally say yes by not saying no. So saying, instead of saying at the end of a meeting when they were like, do you want to work on this? Kind of being like, oh, that sounds great. You know, being really upfront about, you know, I'd love to, but I have to check with my mentoring team first. And using them as kind of my default excuse, like Cariel always tells me this as my primary mentor, ask me before you get involved in anything, so that I can, you know, if I don't want to do it, then I can fall back on that. Gosh, I'd love to, but, you know, I have this commitment that is in the way. I'll circle back and see if you're still available next year, or just being upfront and being like, I'd love to, I'd recommend this person instead, because they sound like that would really work for them, and trying to get out of those opportunities that you don't think would be that beneficial for you.
Thanks, everybody. I guess we have time for one more question. I don't see any hands up or anything in the chat. So I guess just kind of closing thoughts. What have you found? Or how about this? How about a plug for scholarship? Why do you think this is a great thing to add to a career in medicine?
Yeah, I'm happy to say, again, when I first started, I mean, scholarship wasn't necessarily my goal. It was something that I had to do as part of my job. But truly, scholarship just opens up so many opportunities to partner with other people and learn from each other. And I think for me, it has really been the one thing that has really helped support community, both here at UW, but then really also around the country. I have, having gone through COVID, I think, it was a Quality Safety National Society of Hospital Medicine group that I worked with, where it was this bonding around the country to say we are all going through this together. And I think that was something that really enhanced all of our careers. And we actually did scholarship together. So we wrote an abstract on how you build community in the times of COVID, right? So I think it's the connectedness and the excitement to learn from each other.
Love that.
I just want to upvote that comment from Annalise.
I'll
would say-
third vote it. I'll third it. And I've had the same experience that I think work actually not just with colleagues here at the University of Washington, but all over the country in graduate medical education has just been unbelievable and just fun. And doing a mix of patient care and teaching, and really thinking about how to make those better. Really feels reward, and so and you feel a little bit less isolated when you've got a community of folks who have similar passions.
I'll put a plug in for applied research here. A lot of times students get exposed to sort of what I call disciplinary research, like basic sort of understanding of how things are working or descriptive stuff. But when you actually do research that you then see actually leads to a change, like tangibly, you're like sitting on a guideline review committee nationally, or the Department of Health meeting about something, or in my case, working with the Ministry of Health in another country to actually implement something that you've studied. It feels really, really satisfying, because as a clinician on the front lines, you can kind of get lost from day to day thinking the system stinks and it's never going to change or whatever, or it's going to change really slowly. But when you actually get to do something that makes a change at a higher level, it's really, really satisfying. And so I think even there's a lot of hard work involved in kind of getting to that point, it's really rewarding to be able to kind of work on multiple levels to make a difference.
I agree with everything that's been said, and I would add that I think the community is important. Getting to know people around the country and around the world has been such a gift. Getting to know people even across this institution who you might not otherwise meet. But also, I think for sustainability reasons for a career, like seeing patients is like the heart of my career, and I love my patients with like in a very deep and profound way. But I also need to get away from the tree level and into the like airplane level sometimes, to sort of zoom out and think about what are we doing here. So I think having an and to your career, whether that and is scholarship or that and is teaching or that and is administrative, I think it's so life sustaining to have a clinician and I'm something else, so that I can zoom out and sort of get a little bit different perspective on the like sort of daily grind of patient care, which is wonderful and fulfilling, but also exhausting and overwhelming at times.
Thanks. Any last final thoughts from our panel? You guys have been really great. I really appreciate all of your time. I know you guys are